Okay, my name is Dr. Prabhu Nesagika. I'm a senior consultant in GI cancer and robotic surgery at HCG Bangalore. My training has been in UK. I've been there for 18 years. Then I was in Singapore for a year in NUH. And now I've gone back to India to work at HCG Cancer Center. This is a very excellent conference. This is the first time I've come in person. I did my conferences virtually before, but coming here, meeting people, all with the same agenda, same focus. This helps in crystallizing thoughts, exchanging ideas of how we can develop the program and showcase it to the rest of the world. And as I said, it's so nice to see people from Korea, China, India, Malaysia, and the countries go along, Australia, UK. So I think it's a very good effort on part of ASPBM to unite all of us in a common agenda program. So for a very long time, it was always taught to us that blood saves lives. But on the contrary, not giving blood also saves lives. So PBM is an effort from the clinicians as well as healthcare workers and allied staff to ensure that we can offer the patients a choice, for them to know that not taking blood is also safe, they have less complications, and they can go out of the hospital safely. For the wider medical healthcare community, which was not used to this anecdotes before, I think it's a very good thing, like a conference like this, we can come out and showcase that with evidence that PBM is safe, it is effective, and patients have a better outcome when they don't take blood. The best approach for a patient, first of all, even they have to be educated. Like where I come from in India or even from UK, it was very much that patients were a certain group called JOAs who were the one who were driving this. But now we say we should change the narrative. Every patient should have the right to choose what goes into their body. I think if the patient wants to go PBM with enough awareness to showcase it to them, it's actually safe. So we have patients and families in India who come and say, no, I want blood because I've always been told it is good for me. And we showcase them, you don't need blood because you actually can have a good outcome. So I think by conferences like this, by creating awareness among the community and the public at large, to show them that not taking blood is good. So the patients can confidently go to their doctors or their healthcare workers and say, look, can I go without taking blood? And this will help them in the future as well. First of all, many are ignorant to the fact. That's what Martin Luther King had said. Ignorance to the fact that it is safe. So things which we have discussed in the conference, we've had wonderful speakers across every country showcasing that it's very safe, very scientifically based evidence where we can say that it is very safe to adopt PBM program. For medical healthcare workers, I think we should start at the medical education level. Even when I was medical education in India, then in teaching in UK, there is no mention of PBM program in our medical textbooks. So when young doctors are taught that it is safe, then the next generation of doctors will actually adopt PBM as a safe approach. And for existing doctors, when we come to conferences, we show how we do work in our centers and showcasing that it's safe. So I'm a cancer surgeon, we do surgeries without blood transfusion, patients actually go home safe, it's perfectly acceptable. So by showcasing evidence, by showcasing experience, I think we can then engage our other healthcare professionals who may not have an awareness of this program at all to incorporate and embrace it going forward. I would say welcome with an open arm. There's a good group of, in Asia, the ASPBM is doing a very good initiative, engaging multiple physicians to come on board. So all of them to visit the website, look at the programs in their local countries where the PBM program is being implemented, look at evidence across the world, but how programs are implemented safely, patient safety is not compromised, and they all have excellent outcomes. So my only thing is welcome to the group, embrace the program, question what you don't know, because there are people to help them to come out of those questions. And hopefully at the end of the day, we can all show that not giving blood is also really good as well to the patient.